I will be talking about unspecified eating disorder. I have done extensive research on this topic, as well as I was clinically diagnosed with eating disorder not otherwise specified in 2013. Did you know that eating disorders are the second deadliest mental illness? An estimated one death every 52 minutes caused by an eating disorder. And roughly 26% of people with eating disorders do attempt suicide. Today, I'll be educating you on the lack of awareness we have for other eating disorders not otherwise specified. First, let's talk about what the acronyms actually mean. OSFED, or other specified feeding or eating disorder, was commonly known as eating disorder not otherwise specified prior to 2013. It is a less commonly discussed but has a higher mortality rate than anorexia and bulimia. It is an eating disorder that is characterized by a symptomology that does not quite meet the criteria for threshold eating disorders, such as anorexia and bulimia. Nick Calm with the Calm Clinic explains that OSFED is less known than these common talked about eating disorders, but just as dangerous. He says, even though less well known than other eating disorders, otherwise specified feeding or eating disorders can be a serious and life-threatening disorder if not treated properly. OSFED is common, which affects nearly 6% of the population, and the reason for the awareness, yet again, is the mortality rate is 5.2%, which is higher than anorexia and bulimia. Now we should get into the symptomology and the signs of other specified eating disorders. OSFED has two different symptom categories, emotional and behavioral and physical. The emotional symptomology consists of, but is not limited to, being preoccupied with weight, eating, and calories, excessive practice of new diet, typically seen on social media, covering their body with baggy or large clothing, extreme mood swings, and feeling out of control. Calm 2019. The physical symptomology consists of, but again is not limited to, fluctuation in weight that may not be termed as dangerous or out of their weight limit, complaining of pain and other gastrointestinal symptoms and complaints, changes in the menstrual cycle, lab results that are abnormal, for example, an iron deficiency, sleep difficulty, and immune system dysfunction, again, COM 2019. The diagnosis criteria is extremely difficult, which plays effect into the lack of awareness. The diagnosis is consistent with distinguishing the characteristics of all other eating disorders, completely overlooking the eating disorder as a whole sometimes. COM says, for instance, a few healthcare professionals are trained to spot on higher weight anorexics that are explaining the massive problem of diagnosing eating disorders as a whole. Some characteristics may be within normal limits, such as BMI, which causes some providers to overlook their complaints of an eating disorder. Now let's talk about the treatment, the difference between OSFED and other threshold eating disorders like anorexia or bulimia. Threshold eating disorders such as anorexic or bulimia are most commonly talked about. Even given the high prevalence of other specified eating disorders, there's still limited research on it. According to Samantha Whitnell et al. With the Frontier, she says, additionally, because the label is so often used to capture sub-threshold cases, other specified eating disorders diagnosis may be perceived as less severe, which is inaccurate. Anorexia and bulimia have very specific criteria. Studies show that there are very few pathopsychology differences between unspecified eating disorders and threshold eating disorders. Now let's talk about how OSFED is commonly treated and what the risks are, risk factors. The causes consist of a combination. Steve Milken, with the greatest, explains the variety of causes such as genetic, environmental, social, and cultural. An example of genetic would be if a mother or father has an eating disorder, and an environmental factor could consist of overwhelming stress. The treatment for eating disorders in general vary, and an eating disorder is a lifelong battle. It's vital to touch on the barriers of treatment. Carly Thompson in Archives of Women's Mental Health tells us the various barriers for threshold eating disorders as well. Only 10 states in the U.S. require private insurances to cover threshold eating disorder treatment, meaning patients diagnosed with unspecified eating disorders carry no treatment coverage. Insurers claim that the inpatient and intensive outpatient treatment for bulimia and other specified eating disorders are not medically necessary because they generally do not display physical consequences such as anorexia, Thompson et al., 2016. Now that we've covered a major and severely fatal barrier when patients are unable to receive the treatment that they need, I want to touch on why awareness is so important. The mortality rate for other specified eating disorders alone should be enough. But furthermore, the lack of awareness has human beings all over the world suffering silently, believing that their eating disorder is less severe and less valid than threshold eating disorders. The Lancet Psychiatry extended a study that was done in 2019, which left out other specified eating disorders and binge eating disorder. This extended study found that the inclusion of these unspecified eating disorders increased to 0 to 7% instead of 0 to 2%. The inclusion showcased the urgency for awareness of less spoken eating disorders as stated here. Samaranto et al. The inclusion of binge eating disorder and other specified eating disorders in this study will bring recognition of the burden experienced by people living with these disorders. Lastly, I want to talk about why this is so important. In June of 2013, I was diagnosed with eating disorder not otherwise specified before it was changed to other specified feeding or eating disorders. I mentioned earlier that it only takes one comment to alter somebody's life. In 8th grade, one of my friends said that I was fat, and that was all that it took to develop one of the deadliest mental illnesses. 9 years later, I'm still in treatment for other specified eating disorder. I wake up every morning and have to choose recovery. I eat lunch and I have to choose recovery. I eat dinner and I have to choose recovery. In 2018, I was fully recovered from my eating disorder and I was pregnant with my son, who you can see on the left. The lack of awareness that comes with OSFED is what could have killed me. I could not find proper treatment. Had I not chosen to fight for my life, for my family, for my son, I would not be here today. And I said it takes one sentence to alter somebody's life, but it also takes one sentence to make somebody fight. My best friend told me I don't want to visit my best friend in the hospital. And it opened my eyes that my son did not deserve to watch his mother wither away into nothing. I needed awareness 3 years ago, and I will fight every second I can to make sure nobody else goes without the care that I did. Now that we understand the importance of awareness regarding, let's go over some important pieces and what you can do to help. Spread awareness on all social media platforms. Inform Recovery forms the importance of including unspecified eating disorders. Make your own campaign. Join a campaign. Be the change. Let's review some key points. Other specified feeding or eating disorder is a eating disorder that is compiled of a series of behaviors that do not completely fit the mold for a threshold eating disorder, like anorexia or bulimia. The mortality rate for other specified eating disorders is 5.2%, which is higher than both bulimia and anorexia. There is an undeniable amount of stigma regarding unspecified eating disorders, and that alone makes it dangerous. Treatment is difficult to find, and without proper care, you will not recover like I did. Please let it be known that we need to fight for the advocacy for unspecified eating disorders. Nobody should have to die thinking that their illness was not severe enough.